Hi there. Welcome back to another episode of Covering Your Health with Evelyn Erives, presented by IEHP. Oh, I'm so happy to be here with you. I'm a little extra raspy today. I spent a couple weeks getting over a cold and all kinds of things. This is a health podcast, so we figured you'd be okay with a little bit of extra rasp, understanding that sometimes that's the process. It takes a little extra time to get rid of that. But I'm so glad that you're here. As always, we're always looking for topics that not only I find interesting, but we hope that you will find interesting. And today, I really think you will. I think this is going to be something special, especially because um, I don't think everybody has had the experience of an ICU, the intensive care unit. In partnership with Dignity Health, we would love to welcome Dr. Valentina Amaral to the podcast to talk about that topic, ICU, what to expect when receiving care in an ICU, what to expect from the ICU team, how family plays a very, very important role in the road to recovery and really in the entire process. Dr. Amaral is a critical care medicine specialist at St. Bernardine Medical Center and Community Hospital of San Bernardino, serving a diverse population of people and their variety of needs. Most importantly, Dr. Amaral is all about education, which is super cool, and is very eager to help us navigate the healthcare system so that you and your loved ones get the best care possible. I think you're going to enjoy this.
Welcome to Covering Your Health, a wellness podcast dedicated to covering all areas of living a healthy and happy lifestyle. From healthy hearts to understanding health plans and everything in between, each episode will provide you with a better understanding of managing your health, preventative care, and staying on the right path for your family's wellness journey. The Covering Your Health podcast is presented by IEHP. Now, your host, Evelyn Erives.
I am so excited to have you here. Thank you so much for joining us, Dr. Amaral. How are you?
Good. Thank you for having me.
Oh, thank you for being here. So let's get started. Obviously, you are a doctor. You are prestigious in your career. I want to know how that all started for you. Was this something that was a lifelong passion, something that you knew when you were a child you would be a doctor one day, or how did you find this path?
Yeah, so it's kind of interesting because I knew from way early that I wanted to be a doctor, even though I had no doctors in my family. I just felt like I liked that and I needed to go into that. I have a younger brother. He was 12 years younger, and he would get hurt and he would like defer to me, and he would be like, no, mom, you don't take care of me. It's my sister. And so and that brought me a lot of joy.
Oh,
So it started off with that, and then it obviously grew into a love for science, a love for how the human body works, and then here we are.
so that is so amazing. So it's like your brother saw something in you, even at a young age. What is your age difference again?
Oh, we're 12 years apart.
12 years. So that could be part of that, right? And are you
Yeah.
the oldest in your family?
Yes.
Yeah. Oh, yeah. So that's so, so cool. Now you're from Brazil, I understand, right?
Right. Yes.
And at what age did you come here to the United States and find that this was going to be your medical path here? I mean, did you start that there or here?
Yes. So I did my medical school there. I practiced there in emergency medicine for about 5 years prior to coming here. And I came here in 2015 to do internal medicine residency in Baltimore. So I came here pretty late. I was already practicing there.
Wow, that's cool. I can't even hear your accent. So you have a very strong American accent. It sounds like you would never know that you actually spent so much time there.
Thank
Um,
you.
yeah, I'm sure you work hard to do that. I mean, I know that that's like a whole nother thing. But that is so special. What did your family think about you wanting to go on this path?
Um, it's I'm not sure. I thought they initially thought I was crazy. It was like, really? Do you really want to study for that long and then go to the US and then study more?
Oh yeah.
And so but then they realized there was a bit of a method to the madness, and they were on board with it. They're still there. They still live in Brazil. It's
Oh,
just me and
wow.
my husband here. Yeah.
Oh, amazing. I'm sure they're so proud of you now.
Yeah, they are.
That's great. Okay, so let's talk about an ICU, the basics of an intensive care unit. What is an ICU for those who have maybe only heard the acronym and like have no idea what it actually is? And what type of care does an ICU provide?
Right. So an ICU, as the name says, intensive care unit, it's where the sickest patients in the hospital go to. So if they require support for very low blood pressure, if they require support for breathing, or if they have something like a cardiac arrest, things like that, they come to the ICU. So it's basically the sickest patients. We have more nurses assigned. So each nurse has only two patients so that they can pay a lot of attention and take, close care of that patient. And then we are trained in basically resuscitation. So resuscitating the patient, making sure that their blood pressure is okay, that their oxygen levels are okay, and that that the initial reason for them becoming that sick is addressed.
Wow.
In the ICU, there's a lot of machines, and so we can do dialysis in the ICU. We can do mechanical ventilation, which is something that became very popular during COVID. Everyone was talking about intubation and machines to help you breathe. The ICU is the place where we do that.
I see. So now what can someone expect if it's like they get to the hospital, they find out they are now going to be admitted into the ICU? What are some of the first things that they can expect to happen?
Right. So usually we go see them in the emergency department. The first conversation we have, obviously, is what happened, what brought you here, or if the patient can't answer, we'll talk to the family.
Mm.
But I think one of the conversations we have that patients are usually kind of surprised by is code status conversation. And
Oh,
everyone's like, what is a code status, right? So code status is something that is determined when you come into the hospital for us to know what the wishes of the patient are. So would you like to be resuscitated? Would you like to have CPR, meaning chest compressions, meaning restart your heart if it were to stop? Would you like to be intubated? Would you like a breathing tube, a machine to help you breathe? And what are your goals in life? So would you be okay with all these things to be long term, or would you be only okay if these things were short term? And that is extremely important for us because then we know where to go within the care of that patient and how to honor their wishes, not what we think needs to be done, but what they would have want to do if they were able to choose. And so that is one of the first conversations we have when they walk in, even when we don't expect any emergencies to happen, because we don't know when an emergency is going to happen. And it's never
right.
when we, right? It's never when
Yeah.
we plan for it. It's never, and so we have these conversations with all the patients that come in, regardless of what they have, what age they are, or so forth.
Wow. Okay. So you brought up family. Obviously, if a patient is now in the ICU or is about to be admitted into the ICU, and maybe they can't speak for themselves, how important is the family role in that type of situation?
Oh, family is essential. So the family has so many important roles in the ICU. One is to be by the patient's side. So if you can imagine waking up at a different place, a place where you don't know, with a bunch of people you don't know, in a bed, not quite sure how you ended up there. That is terrifying, right? But if you see your family member's face right there next to you, it makes it a lot better. It makes it a lot more tolerable, whatever you're going through.
Yeah.
So family, first of all, is really important to reassure the patient, to, keep them calm and have a familiar face in a very strange environment. And also, when the patient cannot speak, to talk for the patient and tell us what the patient's values are. Because, there's a lot of things we can do in medicine, a lot of gadgets, a lot of machines, a lot of things, right? But I need to know if that is in line with your goals and values in life. And the only way for me to know that for some patients that are unable to respond for themselves is to talk to family and have a little glimpse of what that person is when they're not unconscious, right?
Wow. Yeah, that sounds like that's a crucial role then, if you
Yeah,
are a family member. And it sounds like it plays a big part of the recovery process as well, right?
absolutely. So, I always say we kind of underestimate how much impact our mental health can have in our physical recovery, right?
Yeah.
But we have all types of patients, but the patients who are more depressed or more anxious, they tend to take longer to recover. They tend to not comply with, for instance, physical therapy, which is
Yeah.
a key part of recovery, right? And occupational therapy and speech therapy, and they need to buy into their treatment, and the family is really important. That support is really important to get them to buy into that.
Yeah. Oh my goodness. We talk about communication a lot on this podcast. A keyword that we talk about a lot is the word advocacy and being an advocate for yourself or for your health or for the family member you're there with, right?
Yeah.
What if someone is hesitant to talk in the ICU about important things, maybe not even knowing what are the right questions to ask? Where should they begin? Is there a process to begin that?
Yeah. So things get really complicated in the ICU, right? So we try to update the families every day. And the nurses also update the families every day. But, an update might be a brief, a couple of lines, a little bit of information. And sometimes it confuses the family more than helps, right?
Oh yeah.
So whenever I go into the room, I tell the families, I'm like, there is no such thing as a dumb question. So you start with all your questions. You let me know everything you want to clarify, and I will go over things for you. The internet is always helpful and unhelpful at the same time, right? You
I can
Google things,
imagine.
right? You Google things, and sometimes a really good thing pops up and a really bad thing pops up.
Right.
So don't be afraid to talk about what your background is in your question. So it's like, how are they gonna do? I read online that these things have really poor outcome, right? So I know where you're coming from and what your concern is, and I can address that. Or, I have a family member who had something similar, and I would like to know if this is the same. So I think transparency on both sides is key for us to improve our communication and to get the family to truly understand what's going on when we're updating them.
So I was thinking about like being in high school and my teacher saying there are no dumb questions, but then you still go, yeah, I feel like there are dumb questions, because you don't get that one teacher who's like, well, that was a dumb question. So, so I think in a hospital setting, there really are no dumb questions, right? You have to ask all of the things.
Yeah, absolutely. So, I mean, again, it took us on average, right, 10 years to learn the tricks of the trade. It took us so much time to learn the things that we're trying to implement, that how the treatments and all of that. So I don't expect my patients to understand that first off. Oh yeah, I get this. This is pretty quick and easy. There is no such thing, right? Also, we're well aware that each person is a person, and we treat each patient as an individual. And some things might make more sense for your loved ones than it would make for the patient next door. And it's important for the family to bring up all of their concerns, because maybe their concerns are something I haven't thought about, or some background that they have because they know the patient, and I I never thought, because I don't know that habit, or or that they were doing something, or that they ate something, or it's just hard because we weren't with them when it all started. We were just seeing them after the fact. So in the ICU, there's definitely no such thing as a dumb question.
I love that. I do love that. Okay, then let me ask this. How do you navigate negative energy? I imagine in a very crucial time when a patient is going through a very hard time, it's very stressful for everyone involved. How do you navigate maybe people being upset or maybe not understanding the process fully the way it has to go and it feels too slow? Those kinds of things. How do you handle that?
Well, I mean, having sick patients, it's a given, right? The family's upset. Um, the way I see this, they're not upset at me. They have the right to be upset. That situation is not a situation that anyone should be in, right? And so I try not to personalize it. I like make it about myself. I try to make it about the patient. And usually when families are really, really upset, and sometimes things get a little bit heated, and I
Mhm.
always try to bring it back to the patient. So we're all here for the patient. We're all here to take care of the patient, and we're doing our best. And so,
Yeah.
we all need to work together on their benefit.
Yeah, that's a great way to look at it. Bring it back to center. Bring it back to one, right? This is why we're here.
Yeah.
Um, you know, Recovery is not always easy. I imagine for a lot of people, if you're in the ICU, it's going to take a certain level for you to get back to where you were before you even had to be at the hospital. In addition to the support of your family and friends, why is it important? And I feel like you have such a great positive outlook on this, but why is it important for the ICU staff to also have that same level of care and support and positivity?
Well, I mean, we're all here for the patient. And the patient, again, going back to what an ICU routine for a patient is, the patient is either in pain, it's uncomfortable, just the routine is takes a toll on the person, right? And they have doubts. Am I going to make it out of here? Am I going to make it through this? What kind of deficit I'm going to have? What kind of issues am I going to have after this, right? And it's very anxiety provoking. So I feel like if the environment, the staff around the family keeps a positive, you know,
Like
how to say,
outlook?
environment
Yeah.
around
Mhm.
that patient, it just helps them be positive about their own recovery, right?
Yeah.
So that's why I think it's so important for the whole staff to be on that same page.
What's a great way to limit that stress associated with this whole diagnosis, the care, and then the recovery?
I think focusing on the end goal, right? And that's why when we were talking about code status, I think I always focus on what is your value in life, and that gives you a big picture. So when you look at the big picture, the little hurdles, or the hurdles of right now, are a little bit easier to manage, right? So I try to ask all of them, it's like, what is the most important thing? What is their joy in life? And they'll say, I've had so many different answers to this. It's like, oh, their joy in life is eating, or their joy in life is gardening. And I'm like, okay, so picture yourself gardening, or having a great meal, or whatever it is that you love about life, and just focus on that, right? And I think that helps them go through it.
Yeah, I like that. Paint the picture, make it beautiful, see it, visualize it, and know that you could be there again.
Yeah.
Yeah, that's beautiful. So organizations like the Inland Empire Health Plan, which I owe so much to, and Dignity Health as well, are working to train our next generation of healthcare professionals, people just like you. What advice do you have for those looking to go into medicine and even in more specific, the type of medicine that you're in?
So intensive care is a very new specialty. If anything, like the word intensivist actually came about in 2020. It was added to the dictionary in 2020.
Oh,
So not
wow.
a lot of
Really?
people know what an yeah. It's
That's
very
wild to me.
yes.
Oh
It,
my
it
gosh.
we became popular because of the pandemic. So
Because
we
yeah,
have
I was going to say in 2020. That's why?
not in a good way, but sure,
Right.
we'll take it, right? So for the subsection of critical care, I think you have to, for you to thrive in it, I think you have to care deeply about your patients and really like a fast-paced, chaotic environment of work. But to go into medicine in general and healthcare, either nursing or physical therapy or anything that encompasses healthcare, I think you really need to be a good team player. I am nothing without my nurses. I am nothing without my physical therapist. I am nothing without the team that we have in the
Yeah.
ICU, right? So you need to be a great team player and be able to support and empower the people that are around you for the greater good, which is the good of the patient. Um, so it's usually not the answer that people expect from me, but it is being a team player for sure.
I think that's great advice though. Being a team player works on so many levels, right? It really does. Not even just in the medical field, it really does in general. It serves you right. It will serve your team right and you will look better because of it. I always feel like the people around you make you look good, right? You know if you are delegating correctly, you're going to look like you're doing your job amazing and everyone wins and everybody wins. And I feel like in the medical profession it has to be like that because there are so many facets to care, the nurses, to the medical team, to specialists, to the doctors, to just all of those different kinds of avenues, to even billing, things like that, where that's another stressful thing. I've got to deal with that avenue of all of the things that I just went through my recovery. Now I have to go through that. And if you have a good team around you and you have the right attitude, that's going to get you a long way. So that's good advice. I think that's great advice. Do you tell people when they're going through their programs, to folk, do you tell them like you should look at what I do? Or do you feel like if there was one other there, like, would you rather be in private practice or like, what do you say? I'm curious what your thought is on that.
We have trainees here, and I don't necessarily tell them to look at what I do, but I always tell them when you're picking things, your specialty or subspecialty or whatever it is, just look around, right, and see if the environment is something you would like to be in. And so that makes it a little bit easier. The other thing I tell them all the time is treat your nurses well. Because if you treat your nurses well, you're golden. They're going to
That
take
is
great care of your
key.
patients.
That is key. And I'll tell you this from a best friend perspective. Both of my best friends are nurses. And I will say the same thing. I know their feistiness and I know how amazing they are. And I always think that too. And I was like, they better make sure they're treating you well because you're going to do them really good.
Yes, that's the trick of the trade.
It really is. And I love what you said about like know what's around you while you're training and deciding what you're going to be specializing in because this is the time when you decide what doesn't work for you, right? I
Yeah.
even say that same thing to my oldest daughter. She's in the workforce and she's learning what she doesn't like. I said, this is the time you learn what you don't like. It's not necessarily to find what you love, it's to find what you don't want to do because there's going to be a lot of things you don't want to get stuck doing if you don't like it.
Yeah, which is 50%, right? Like if you find out what you don't like, what you really don't want to do, you're halfway through, right?
Yes. Yes, for sure. Before we let you go, I know you were very busy. I know you got your scrubs on. You are working, girl. So before I let you go, I have one last question. What are the three key takeaways that you hope people who are listening to this podcast today really truly take home with them?
So first, talk to your family members while they're, at with you and doing well. Talk to them about what their goals of in life are, what they want for themselves, and in a situation like this, because no one thinks it's going to happen. But when it does, it helps a lot if you've talked about it before and if you have the answer from their perspective. It takes a little bit of the blame from you and the guilt from you, and it just puts a different perspective into all the decisions that have to be made in the ICU. So that is one of the things. The other thing is, going back to what we said, there is no such thing as a dumb question. Please ask all your questions, write them down, and feel free to approach us with all of those to make sure that you understand what we're doing for the patient and that we're all on the same page. And then the third thing is, try to keep positivity. Even when things look grim, I think we can still make things better for the patient and for the person who's lying there. So keeping a positive attitude, even when things don't look great.
I think those are great key takeaways. You're absolutely right. Talking to your family. And I feel like that the first one that you said doesn't have to happen when you're in later life. It should happen at any moment, right? Anything could happen at any time. And having those serious conversations need to happen at all walks of life, right? So wonderful. And then, of course, no dumb questions and staying positive. Thank you so much, Dr. Amaral. This was wonderful. I feel like we got a little bit more insight knowledge into the very new term of intensive care. That actually blew me away. I'm very surprised by that. But I feel like, it makes it a tiny bit less scary when you know just a little bit more about what goes behind the care, specialty, why everybody's there, and how much they're going to care for you when you're in that situation. So thank you so much for joining me today
Thank
and being a
you.
guest.
Thank you for having me.